You lie down to sleep and within an hour you're suddenly wide awake. There is a burning sensation in your chest. A sour taste creeps into your mouth. You start coughing like you caught a cold. You prop yourself up on pillows, take an antacid, hope it goes away. But if this keeps happening at night, you need to know this. Nighttime reflux is not the same as occasional daytime heartburn. It is often harder to control, it can last longer, and it can do more damage. I'm Dr. Kethu, a board-certified gastroenterologist, and in this video, I will explain why reflux gets worse at night, what's actually happening inside your body, and what really helps. First, let's define the problem. Acid reflux happens when stomach contents move backwards into the esophagus. Normally, the lower esophageal sphincter acts like a valve. It opens when food goes down. Then it closes to keep acid in the stomach. But if that valve is weak, relaxed at the wrong time, or overwhelmed by pressure, acid can escape upward. During the day, gravity helps keep that acid down. But when you lie flat, gravity stops helping. That is why nighttime reflux is often worse. There is another reason night reflux hits harder. When you're awake, you swallow more often. Every swallow brings saliva down the esophagus, and saliva helps neutralize acid. At night, swallowing becomes less frequent, saliva production drops, so if the acid reaches the esophagus while you're asleep, it can sit there longer. That means more irritation and more damage. Your esophagus is not designed to handle acid exposure for hours. It's also important to understand that reflux does not always feel like classic heartburn. Some people get chest burning, others get regurgitation, others get a bitter or sour taste, and some people barely feel heartburn at all. Instead, they get a chronic cough, or hoarseness, throat clearing, or a lump in the throat sensation, or a sore throat in the morning. That is often called laryngopharyngeal reflux, or LPR. People sometimes call it silent reflux. It's silent only because it doesn't always burn. It can still be very real. Why does that matter? Because someone may think they have allergies, a postnasal drip problem, or asthma, but the real issue may be reflux reaching the throat and voice box. The tissues there are more sensitive than the esophagus. Even small amounts of reflux can trigger big symptoms. Now, let's talk about the biggest triggers of nighttime reflux. The first one is eating too close to bedtime. If you eat a large meal and lie down soon after, your stomach is still active. It is producing acid to digest the food. It is also full and under pressure. That makes it easier for acid to move upward. The usual goal is to stop eating at least 3 hours before going to bed. For some people, even 4 hours is better. The more full your stomach is when you lie down, the more likely reflux becomes. A big meal is not the only problem. High-fat meals can also delay stomach emptying. That means the food stays in the stomach longer. The longer food sits there, the longer the stomach keeps producing acid. Fat can also relax the lower esophageal sphincter in some people. That creates a double problem. The second major trigger is sleeping position. This matters more than most people realize. Sleeping on your right side is usually worse for reflux. That is because of the anatomy of the stomach and the way acid can pool near the esophageal opening. Sleeping on your left side tends to reduce reflux. That position keeps the stomach below the esophagus more effectively. In practical terms, left side sleeping helps gravity work for you instead of against you. If you only remember one sleep-related tip, this is it. The third issue is the pillow myth. A lot of people stack several pillows under their head and think that they're elevating themselves. But that usually does not help much. In fact, it can make things worse. When you only lift the head and neck, you bend at the waist. That can increase abdominal pressure. The stomach gets squeezed and the acid has an easier path upward. What you really want to do is to incline across the whole upper body. A wedge pillow can work. Even better, raising the head of the bed by about 6 inches can help. That's what I recommend to my patients. That means placing blocks under the bed, legs at the head end. The goal is not just to lift your head, the goal is to create a true slope. Let's talk a little more about anatomy because this explains why these changes matter. The esophagus is a muscular tube. Its job is to move food from the mouth to the stomach. It does not have the same protective lining that the stomach has. The stomach is built to handle acid. The esophagus is not. So when acid keeps coming back up, the lining gets irritated. That irritation is what causes symptoms. Over time, repeated exposure can lead to inflammation and complications. One complication we worry about is the esophagitis, that means inflammation of the esophagus. People can feel pain, burning, or trouble swallowing. Another concern is Barrett's esophagus. That is when the esophageal lining changes over time from chronic acid exposure. It's a precancerous change, which is why persistent reflux should not be ignored. Not everyone with reflux gets Barrett's, but long-standing symptoms deserve proper evaluation. Now let's go over medications because timing matters a lot. Antacids like Tums can help quickly, but they are short-acting. They may also only last a short time and are often not enough for frequent nighttime reflux. H2 blockers like famotidine, which many people know as Pepcid, can be more useful for nighttime symptoms. They reduce acid production for longer than antacids. They may help if you know reflux tends to hit after dinner or during sleep. If you are on a proton pump inhibitor or a PPI, timing is critical. PPIs are not rescue medication. They do not work best if you take them at bedtime. They work best when taken before a meal, usually 30 to 60 minutes before breakfast. That is because they are designed to block acid pumps when those pumps are getting activated by food. If you take a PPI at the wrong time, it may not work well at all. This is one of the most common mistakes I see. Some people still have symptoms even when taking a PPI correctly. In that situation, ask your doctor about an alginate product. Alginates work differently. They form a physical barrier or raft on top of stomach contents. That barrier helps keep acid from rising into the esophagus. It is not just about reducing acid, it is about blocking the reflux mechanically. That makes alginates especially useful for post-meal or nighttime symptoms. Now, let's talk about lifestyle changes that really matter. First one is follow the 3-hour rule. No food for at least 3 hours before bed. That gives your stomach time to empty. Second one is sleep on your left side. This is one of the easiest and most effective changes you can make. Third is reduce your personal triggers. For some people it is chocolate. For others, peppermint. For others, tomato sauce, spicy food, coffee, or alcohol. The reflux trigger is not the same for everyone. The key is to notice your pattern. Alcohol deserves a special mention. Even one drink can worsen reflux in some people. Alcohol can relax the lower esophageal sphincter. It can also irritate the lining of the esophagus. So if your reflux is worse on nights when you drink, that is your clue. Some patients also benefit from smaller dinners. A huge dinner is harder to digest than a lighter one. If you are prone to reflux, make dinner the smallest meal of the day. Eat slowly, chew well, avoid lying down right after eating. These are small changes, but they add up. Weight can also play a role. Excess abdominal weight increases pressure inside the abdomen. That pressure can push stomach contents upward. Even modest weight loss can improve reflux in some people. So this is not just about what you eat, it is also about pressure dynamics inside the abdomen. Stress can make reflux feel worse too. Stress does not necessarily cause acid reflux by itself, but it can increase symptom perception. It can make the esophagus more sensitive. It can also lead to late night eating, poor sleep, and worse habits overall. So the brain-gut connection matters here too. Now, let's cover when you need to see a doctor. If reflux happens more than occasionally, it should be evaluated. If you have difficulty swallowing, that is a red flag. If food feels stuck, that needs attention. If you're losing weight without trying, that is a red flag. If you have black stool, vomiting blood, or anemia, that is also urgent. If symptoms keep coming back despite 8 weeks of treatment, you may need an endoscopy. If you have frequent nighttime reflux, especially with cough or hoarseness, you should not just keep guessing. A lot of people try to manage reflux forever with pillows and antacids. But if symptoms are frequent, the goal is not just temporary relief. The goal is to protect the esophagus and treat the cause. So, here is the short version. Nighttime reflux is worse because gravity is gone, swallowing slows down, and acid stays in the esophagus longer. Eating too late, sleeping on the right side, and using the wrong kind of pillow can all make it worse. Left side sleeping, the 3-hour rule, and proper bed elevation often help more than people expect. Medications help too, but timing matters. And if you have warning signs or persistent symptoms, you need medical evaluation. Nighttime reflux does not have to control your sleep. You deserve a full night of rest. Try the left side sleeping and 3-hour rule this week. And if symptoms keep happening, get it checked. If this was helpful, comment left. If you have any other comments to make, please drop in the comments. I read each one of them and respond. Thank you for watching.